All right, so I just want to thank Dr. Mercado for joining us today. Dartmouth was our partner of the month for November. So they're here to kind of give us an overview of what's going on in the state with the COVID-19 pandemic and, talk about vaccines a little bit. So I'm just gonna make you the host and you guys can get started so he can share his screen. Thank you so much.
It should be on audio.
Awesome. Thank you. Thank you for having me.
Go away and be on audio.
Hit that, join audio.
Why don't I do with you?
And I just wanted for folks to confirm that you guys are seeing this.
Yes.
Awesome. Okay. Yes, I will be talking about giving you some COVID updates. And in this first slide, it just shows us cases of COVID from the global perspective. Where we are seeing the most currently is in Africa. As some people may be aware, the Omicron variant was first reported from South Africa, and that is likely what's driving some of the newer cases that they are seeing. The United States is just kind of classified below these twice as many new cases. We're on the more new cases category. And part of why I wanted to show this slide is that for us to really be ahead of this pandemic is that we need to have equity with when it comes or where it comes to our vaccination, because we are a global community and people travel from different countries and different communities, and it does help if we have a lot more individuals or countries with who are immune to the virus. This is updated as to Saturday, and unfortunately, we are seeing a surge in cases. So of the most recent 7-day average, we are seeing an increase of about 37%. On the right slide is just kind of gives you an idea of the timing of the spikes in cases. So for example, as you guys may all know, New Hampshire is we're having quite a bit of a surge this winter, more so unfortunately than the past winter. And the answers are not any different. If we want to be able to be ahead of the curve or kind of help mitigate these rise in cases, we need to continue to advocate for vaccination and have a consistency with our mitigation strategies with masking, physical distancing, and hand hygiene. As of last week, again, these were updated over the weekend. New Hampshire was reporting about 1,208 cases per day with 11.8% 7-day test positivity and 400 plus hospitalizations, while Vermont were reporting 260 cases, 4.8% 7-day test positivity, and 76 hospitalized. And the biggest concern for me right now is the rates of hospitalizations. And the reason why I say that is because we would want to avoid to be in a situation where the cases and hospitalizations start to overwhelm the healthcare system. We want to be able to keep all our service lines open, take care of COVID patients, but at the same time, we do have other patients and other chronic conditions that we need to pay attention to and continue to give the best care for. And again, the answers don't necessarily change. Vaccination, masking, hand hygiene continues to be the answers that would help mitigate further rise of cases. What's different between this surge compared to last is that we now have staffing challenges. And the governor did ask for the National Guard to kind of help us with our current winter surge. And as an example, for Dartmouth Hitchcock alone, we have a lot of open positions, whether it be our frontline healthcare workers or not. And just wanted to take this opportunity to give a kudos to our frontline healthcare workers who are really just heroes who've been passionate and dedicated into making sure that our patients continue to have the best care despite these challenges. But we also do need to pay attention that our kids are not being compromised with the situation. Our Surgeon General, Dr. Vivek Murthy, had, this is something that we are aware of and continues to be an advocate of, is that we need to make sure that our kids are protected and that we are all aware of kind of like the looming mental health care crises. We've seen with some of the lockdowns or transition to virtual learning, how we've seen a spike in things like depression and anxiety. One of the things that would contribute for a school to maybe consider a transition back to remote learning is if they see a sudden spike in cases. And we do have data as to how consistency in students and teachers wearing their masks reduce the likelihood of having to transition to remote learning. As you all know, our kids do need that social interaction, social development as part of their growth and developmental skills. So, that was just kind of a brief update on the data with regards to the numbers. This is now transitioning more towards our vaccination. And as this slide states, as of December 9, we have 60% of our population fully vaccinated, and out of the 200 million, 49 are boosted. As you can see on the trend here, we had an initial spike in vaccination, and then that kind of dropped. But with the ongoing reports around Delta variant and Omicron, as well as the spike in cases, I think that has boosted our efforts to really encourage vaccination and boosting, and that's contributed to the 29% increase in individuals getting the vaccine. As far as New Hampshire is concerned, as we can see, as the age goes down, the vaccination rates go down. The reason for this is probably multifactorial. One of the factors being the younger population may be feeling less vulnerable. Earlier on in the pandemic, we've kind of shared how older age groups are at higher risk for severe disease. And that may have influenced some of these decisions as far as getting the vaccine versus not. One thing I would add, though, is that as we have been able to vaccinate our older age group, what we're seeing in the hospital is a younger, unvaccinated population of individuals. So again, just even more reason to be vaccinated and boosted.
Question for you. What is that percentage of people who are in the hospitals who are unvaccinated?
Yes, I would say that a large percentage still remains to be unvaccinated. As you can imagine, that number tends to fluctuate. Last I did check, it was close to about 80% of our inpatient population are unvaccinated. One thing to kind of remember, though, we do surveillance testing. What that means is that individuals who are in the hospital for other reasons are tested. And occasionally we see individuals who are not in the hospital for COVID test positive too. So, some of the mix may be because of, again, inpatient admissions from individuals who are in the hospital for things other than COVID. So as I mentioned, the unvaccinated remain to be at the highest risk. 3 times more likely with regards to infection, twice more likely with regards to hospitalization, and 7 times more likely when you're talking about death. This is an article from the Journal of American Medical Association, which just gives you an idea of how having more members of the family vaccinated reduces the likelihood of a COVID-19 infection for other family members. So there is a protective effect. And as you have more individuals vaccinated within the family, again, the chances of COVID-19 infection reduces. This just compares COVID-19 infection from vaccination. And as this kind of state, unvaccinated people with previous infection were still more likely to have COVID-19 infection when compared to vaccinated people. And when it comes to 2 doses versus 3 doses, or the primary vaccination versus having a 3rd dose and or a booster, there is still benefit from getting the booster. So we see a 93% reduction in hospitalization and an 81% reduction in COVID-19 death for those who get boosted. Part of this is waning immunity. But as you guys could imagine, one way to kind of think about it is that when you boost your immune response, you kind of have more antibodies or soldiers to fight off the infection. And as expected, it leads to reduction in your chances of having severe disease.
Another question for you. Those people who are not getting vaccinated oftentimes worry about the adverse effects of being vaccinated. What are the percentages or statistics on significant adverse reactions to the vaccine?
Yeah, this slide speaks to it a little bit. This primarily talks about the booster. The benefit here is, the prevention of COVID-19 hospitalizations per million doses. And the risk at this point, particularly when it comes to the younger age group, is myocarditis. And this kind of speaks to the rates of myocarditis. It's 1 per million doses for females in the 18 to 29 age group, and then 13 per million doses for males in the 18 to 29 age group. And in addition to this, if you think about it, your likelihood of myocarditis is 16 times higher if you were to get COVID-19 than it potentially coming from a vaccine, the vaccine. So this is kind of the basis of why the CDC had approved booster doses in the vaccines. I would say the vaccines remain to be the safest option for individuals to have immunity against the infection. And if you weigh the risks when it comes to adverse effects, the benefits of you preventing severe disease, hospitalizations, and deaths certainly outweigh this unlikely scenario, kind of rare cases of adverse effects such as myocarditis.
So
Oh, I'm sorry. Where are these studies coming from about the myocarditis? Because it's just been a short amount of time. Is it correct that we've had this? Whether we're on our second year, and is it from our country, other countries?
Yeah, you know, the studies do come from different countries, including ours. One of the countries that is frequently used with regards to data is Israel, and that's just because of how their healthcare system works. So the likelihood of us, I just wanted to kind of frame the time frame that you had shared based on what we know when it comes to vaccines and other viruses in general, is that when it comes to the vaccine and vaccine adverse effects, the likelihood of us showing more cases or other adverse effects is really rare or small as compared to the time period that we already have. And that really just speaks to our experience with vaccines in general. We can't ever really guarantee that nothing other than what has been stated will be any different in the future. But we can speak to the chances of what that might look like, or the rates of the chances of the information changing, which again, it's unlikely to change from what we're already sharing today.
And is myocarditis the most significant adverse reaction that people have, or are there others that aren't quite as bad at that, but still a significant risk for them statistically?
My slides speak to mostly about the messenger RNA vaccines, and a lot of the kind of attention has really focused on myocarditis, particularly as we've expanded the eligibility criteria to the younger age group. Others may have been or may have heard about other potential risks when it comes to the Johnson & Johnson vaccine, such as the risk of thrombosis, although that's a smaller population. But to answer your question with regards to other bigger adverse effects, when it comes to Pfizer, let's say in particular, it's really the myocarditis and not much of anything else.
Good to know.
And this just gives us an idea of the eligibility. This had most recently changed again as the FDA and the CDC had recently expanded the eligibility criteria to include 16 and 17-year-old individuals to get the booster. I would now kind of transition to Omicron, which was first confirmed back in December. We've heard about how it has a large number of mutation to the spike protein, and that is really that kind of knob-like particle that we've seen pictures of the COVID-19 virus of. And that is important because that spike protein and mutations in the spike protein determines the behavior of the virus. Some of the more important things that are related to that is Omicron more transmissible than other variants of concern? Would these changes lead to a more severe disease? And would these changes lead to reduced effectiveness of vaccines as well as other treatment for COVID-19? So the spike protein is really what kind of helps the virus attach to human cells. So these is really how these changes affect the behavior of the virus. The CDC just recently shared the characteristics of the initial 43 cases in the United States. 79% were fully vaccinated. 58% was a younger age group. 33% had traveled internationally. And one thing to note is that these fully vaccinated cases, only one did require hospitalization, and it does reinforce the fact that being vaccinated and boosted helps prevent severe disease. There is report too in South Africa as to how patients who only had a primary series or prior COVID-19 infection had a 40-fold reduction in antibody neutralization. So Pfizer at the same time had shared that receiving the booster dose leads to 25-fold increase in antibody neutralization. So this just kind of reinforces that having that boost in your immune system would allow you to have a better ability to kind of fight off the virus and really protect you from severe disease. This is just a plug for additional layers of protection. Vaccine saves lives, and it's really our best way to protect ourselves and others around us. Being vaccinated doesn't necessarily mean that we should relax other layers of protection. So masking is still important in our respiratory hygiene. And when we're not masked, it is still important for us to observe physical distancing. And on top of all that that I just mentioned, we should always frequently wash our hands or observe hand hygiene, particularly when we are frequently touched surfaces. And then, before kind of touching our nose or our mouths and things like that. This would be a good tip for the holidays to make sure that, when we're gathering, kind of consider the vaccination status, wearing this additive layers of protection, such as masking, and again, physical distancing, when we're not able to wear our masks. So for those individuals who are not vaccinated, or individuals who have weak immune systems, I would probably encourage being innovative and consider virtually attending some of these holiday gatherings. I did want to finish with just letting you all know we do have a podcast. It's called The Cure, which kind of talks about all things related to COVID as well. So I'll stop sharing, and I'm happy to answer questions. I did have a few more slides, but I did know that or wanted to give folks an ample opportunity to ask questions. And then if we had extra time, I can go over some of the other slides.
Thank you. I had one, and I may have misheard you, but were you saying that of the Omicron cases, 79% of those cases were with vaccinated people?
Yes, and to be exact, about 34 of the 43. So we do know that the vaccine is not 100%. These fully vaccinated were a mix. So some of them have not received a booster yet, and yet again, another smaller portion of them received their booster quite early, so they didn't have the immune effects into their system yet. But how I would interpret this data is that these patients, although they were fully vaccinated and had the infection, it is important to know that it did not lead to severe disease. And I think the other thing I would say to that, it is a relatively small number. It's 43 patients, so we do need a tincture of time to really determine what the effects of the virus is to vaccinated individuals. The beauty of having messenger RNA vaccines is that we have the technology now to change the targets, that spike protein that we were talking about, so that it would be more effective in targeting the Omicron variant, and for us to see a smaller number compared to what I just shared. Moderna and Pfizer have already shared that they are going to be working on that. So we may have a new vaccine that targets Omicron specifically, possibly as soon as spring. In the meantime, as I kind of mentioned, Pfizer also did share how getting your booster dose would result in a 25-fold increase in antibody neutralization. So as we wait for more information around that, I think if you're eligible, it's best to get boosted. It would offer you that additional layer of protection.
And another question, how about passing this on? Has getting the vaccines and the booster shot, does that make any difference? I know that we won't get it ourselves as badly, but does it limit our ability to pass it on to others?
Yeah, the short answer is yes. If you remember that slide that I showed, where having more family members.
Oh, right.
Reduce the COVID-19 infection in non-immune members. I would not rely entirely on that in a sense that, again, I think what we've seen is that as people get vaccinated, we've had a tendency to relax our other mitigation strategies. So I would encourage, particularly as we see these variants that are more transmissible, more infectious, to continue to have additional layers of protection. And again, that would be wearing your masks, physical distancing, and hand hygiene.
Thank you. Mm.
Other questions?
I guess just another question is, in the past, when some of these flus or SARS or whatever COVID came along, were they doing all of these? I don't remember. It wasn't maybe in our country quite as much, but I don't remember hearing about so many vaccinations and boosters and you know, as it the variants continue coming. This just seems to be so much more, what's the word I want? I don't know. And so do you think that we'll be continuing to have a lot more of these vaccinations, or needing to have a lot more?
Thanks, Lynn. Yeah, that's a very good question. So, we'll go to the virus first, and it is an RNA type of virus, and what that means is that it lacks the proof reading skills as it makes more copies of itself. So they are essentially errors or mutations. And, a lot of these errors or mutations tend to be a mix of, it doesn't change the characteristics of the virus. Some of them actually lead to a disadvantage to the virus. But, when it comes to kind of like that survival of the fittest, some of these mutations lead to a certain advantage. Such as what we've seen with Delta and Omicron. And when it leads to that advantage is what then it allows it to become the predominantly circulating variants of concern.
Mm-hmm.
So really the first step there is that for us to see less emergence of the variant of concerns is we need to stop the spread of infection. And that just goes back to when these things happen. So if you have less virus burden in the community, less virus making copies of itself, then you give the virus less chances of making errors or having mutations that could possibly lead to its advantage. And really, again, the way to stop the spread of infection is to be immune to the virus. I think we've heard this a while back, conversations around herd immunity.
Mm-hmm.
And what that is that theoretical or that number of individuals who are immune or not susceptible to the virus, whether it be through natural infection or vaccine-induced immunity, that then also protects individuals who may be susceptible. And that is really also determined by how infectious the virus is. So what that means is that if you have a more infectious virus, then you would need to have more members of your community or let's say family immune to the virus for it to for the infection to stop spreading essentially.
Mm-hmm.
And if you compare, immunity from natural infection compared to the vaccine-induced immunity remains to be safest. Because, if you compare the robustness and the duration of the immune response The duration of you being immune to the virus tends to be shorter from those who got natural immunity compared to those who had the vaccine. It's just a more robust response of the immune system. Plus, you kind of risk um, uh, potentially developing severe disease by catching the infection. Comparing, the kind of like your two options. Your risk of reinfection also increases with natural immunity. And we all know that a certain percentage of individuals are also at risk of what we may commonly term as long COVID, which again, you might develop from a natural infection.
Okay.
With regards to how many more boosters or vaccines are we talking about? It's really hard to predict what the future looks like. It is possible, similar to the influenza vaccine, where we would have a shot every year. I think that's something that we could possibly see. It really depends on how long our immunity lasts. And really, the first step in being ahead of this pandemic would be um, uh, how we are able to reduce the number of hospitalizations. Because again, as I previously mentioned, we want to be able to move away from the potential of overwhelming the healthcare system.
Mhm.
Are the symptoms for COVID and Omicron differ?
It's really early in this, I guess, as far as trying to describe what the symptoms might be. So the CDC did report with those 43 cases that one common some of the common symptoms shared by those individuals were cough, fatigue, and nasal congestion. So it's hard to make definitive conclusions this early into this variant spread. But at least that's kind of the initial information that had been shared with us.
Thank you.
And is there anything that you know of in addition to these vaccinations that we're getting, as far as I'm thinking also holistically, any type of I don't know, supplements or anything that we can do to boost our immunity, help us in another way?
Yeah, a healthier immune system does help. But yes, outside of the vaccines, we've had a tremendous amount of work in development. One of the most recent ones was the approval of the monoclonal antibody from AstraZeneca. This is a pre-exposure prophylaxis. It helps prevent individuals from catching COVID-19 within 6 months of receiving this monoclonal antibody. The data showed a 77% decrease in chances of catching COVID-19 or developing COVID-19 infection. But these are really for individuals who are immune compromised and were not able to develop that immune response from the vaccine. These are also for individuals who may have had adverse reactions such as anaphylaxis to the vaccine. So that's just one example. There are monoclonal antibodies for treatment of mild disease as well as post-exposure prophylaxis. You've been exposed to an individual who has COVID and you have risk factors. you might be eligible for other monoclonal antibodies that would reduce your chances of developing severe disease. Those are just some of the examples. We've also made tremendous kind of developments around treatment. So over time, as we've developed these treatment and preventive management strategies, we've been able to afford better care for our COVID patients.
Thank you.
Anything else?
Not for me.
Well, if there's not any more questions, I would just like to end, with saying that COVID-19 is really a preventable crisis at this point. And we really should feel empowered that our decisions would affect how we are going to be able to beat this pandemic and transition and be able to move forward. So I think if we all really just work together and get our shots, get our vaccines, and if and when we're eligible, get our booster doses, continue to follow the mitigation strategies around masking and hand hygiene, as advised by public health professionals. I really think that this would carve our way out of being able to move forward and not having to worry about hospitalizations, not having to worry about overwhelming the healthcare system, and really just going back. It might be the new normal, but just having that hope of going back to our new normal, not only for ourselves, but for the future generation. All right. Well, thank you all.
Thank you very much.
Thank you.
Thank you.